Hi, I'm Charlie Talbot. I'm an orthopaedic surgeon specialising in shoulder and elbow surgery. And today I'd like to talk to you a little bit about rotator cuff related pain. So what is the rotator cuff? Well, it's a group of muscles around the shoulder that do as it says, which is to rotate the shoulder both in and out, but also to rotate the shoulder up and help elevate your arm. I see lots of people with shoulder pain, and quite commonly this is related to the rotator cuff. Rotator cuff related shoulder pain is an umbrella term that describes a number of different issues. That can be something as simple as tendinopathy or a disease within the tendon itself. It can be bursitis, which is inflammation in the fluid-filled sac that surrounds the rotator cuff. It can be calcium within the tendon itself, which is calcific tendinitis, or it can be partial or full thickness tears of the rotator cuff itself. Not all patients require surgery. In fact, the majority of people who come to see me end up having non-surgical treatment, quite commonly with injections and a period of physiotherapy. So what happens when you come to see me? Well, we go through the diagnosis, which is me asking questions and then examining you to come up with a clinical diagnosis, which is often added to with scans or x-rays, which include ultrasounds and MRI scans, to confirm the clinical suspicion and give a good indication on the diagnosis. For me, it's very important that patients have individualized treatment, and it's very important that patients have all options explained to them. So for me, I like to work through the diagnosis so patients have an understanding of exactly what's happening, but then also the treatment options that are available to those individuals. Those will be broadly split into non-surgical and surgical treatments. As I mentioned briefly, a lot of non-surgical treatment is injections and periods of physiotherapy to work on the other muscles around the rotator cuff, which can help strengthen these to compensate for problems within the rotator cuff itself. And the surgical treatment depends on whether there is a tear in the rotator cuff or not. Rotator cuff tears are diagnosed on imaging, such as ultrasound or MRI scans, and not everybody who has a rotator cuff tear needs an operation. However, patients who are young, active, and have pain and loss of strength from a rotator cuff tear will benefit from an arthroscopic or keyhole repair of the tendon itself. This is something we do as a day case operation, something that is relatively safe and straightforward to do, and something that I do a lot of. Patients then have to go through a period of rehabilitation to ensure they regain the movement in the shoulder, and then they go through a strengthening phase to start building back up the strength and function in the shoulder so that patients can return back to their normal activities, including sports and work. Rotator cuff surgery is, as I said, relatively safe. There are a few complications that we do everything we can to try and avoid, but overall patients who are selected for surgery and want to go ahead do extremely well.